We are joined by R.S. Sharma, who's the CEO of the National Health Authority. Sir, thank you so much for joining us. You've created, or you're looking after, a new integrated unified health platform. And this unified health interface has been created. How does this actually work?
And the idea has come basically from the unified payment interface. Now, what that means? That means is that we want to have a complete interoperability. Like in unified payment interface, you are able to transfer money from any bank to any bank, from any bank to any wallet, and stuff like that, to any bank, to any person also on telephone number or whatever. So this is the basic issue, that we are creating a framework where anybody could be able to search for doctors, search for laboratories, search for ambulances, search for blood banks, using the same standard API, and then could get the results, and then he could book those facilities, whether it is an ambulance or whether it's a test, diagnostic test, or whether it's a doctor, or whether it is actually booking an admission in the OPD of any hospital. So that essentially is the next part. And then finally, it should be able to avail the services, which is that you can do teleconsultation, you can go there and get the vaccination done, or donate the blood. So basically, we are talking of interoperable telecommunication. We are talking interoperable commerce, purchasing of medicines. We are talking of interoperable booking of let's say, slots in the hospital or ambulance and things like that. That is the overall comprehensive framework, which essentially will actually enlarge the availability of services to everybody without everybody downloading these applications.
So the CoWIN app, sir, was created for the COVID vaccines, and now there is a plan to repurpose it for all of the vaccinations and even for blood and organ donations. How will this roll out?
Absolutely. I think this is also a part of the same health stack. Essentially, let's say what happens is that what does CoWIN do? CoWIN provides for the citizens, it provides services to locate the vaccination centers. It provides services to provide the information as to where are the vacancies available, which vaccination center is providing which vaccination, let's say, whether it is Covishield or Covaxin and stuff like that. And then from the hospital's point of view, hospitals are able to publish their vacancies, their timetable, their time schedules. And then from citizens' point of view, they are able to download the certificate. From the vaccinator's point of view, they are able to identify a person and vaccinate, right? These are all the stakeholders, the vaccinator, the hospital, the patient. Now, what we are saying is there is fundamentally no difference between the COVID vaccination and the immunization vaccination. It's essentially expanding the scope and repurposing CoWIN for doing those kinds of things also. Wherever you have a demand, where you have a supply, and then you can make them meet and you can provide information to the seekers in a transparent basis, and then provide them facility to book and provide them facility to basically approach and get the vaccination done.
So, but while it's important that our health access becomes digitized, in India we have so many vulnerable groups, like a lot of our tribal groups who are so marginalized, as we heard from the Mushahars earlier today. So how will they have access to this? I mean, they're the people who probably need the greatest access to medication, medicines, good healthcare. So how will they access this technology?
No, first of all, that's a very, very, very good question, Swati. And I think the answer to that is as follows. India is an extremely diverse country. And what is happening is that we need to have any solution which is there, rolled out, digital solution, that has to be inclusive. So, for example, we have in CoWIN, we had the system of prior registration, but we also had the system of walk-ins, where people would come and then they could get digitally, sort of vaccinated and digital records created. So basically, and we also have assisted places. We have the common service centers at the village level, which provides these kinds of small digital services to the people. And fortunately, now we have mobile numbers, at least feature phones to everybody. And like in CoWIN, we had said that on one account, there can be 6 family members who can basically create an account and create the records, etc. Similarly, we will have this also. It's not necessary that everybody who is doing it has to have a smartphone. There could be one member in the family who has a smartphone, and then every family member could come into that.
Ram Sevak Sharma, thank you very much for joining us.